All right, so welcome everyone. On behalf of Primary Healthcare Corporation, we want to first welcome you to the World Accreditation Day. I'm pleased to be here with you, talking to you a little bit about primary healthcare and its journey. So what I would like to cover in the next 15 minutes or so is a little bit about Primary Healthcare Corporation, the service it offers, the journey that we had actually taken on virtual health services. In lights of the theme that we have for this time, we'll talk about the information governance. We will not forget our patients and their involvement with the work that we've actually done. And we'll finally wrap up with talking about some of the aspirational work that's actually happening at the governmental level, at the national level, and leave you with some things to consider. So first and foremost, Primary Healthcare Corporation, it is leading the transformation of health and well-being of the state of Qatar by shifting its balance from the balance of care from curative hospital-based treatment to more enhanced preventative health and wellness services in the community. So the vision for the primary healthcare is to be the leader of transforming the health and well-being of the people of Qatar. It began in 1954 with few polyclinics, and by 78 we had about 9 health centers. And then since 2012, when primary healthcare became the independent or corporation, we've actually seen our health services and health centers expanded. Our scope of services expanded to the point where we now have 31 health centers. Our focus, as I mentioned, is on health promotion, disease prevention, and we're actually applying the holistic approach of care by making sure that we embrace the technology and ensure that we're actually always looking for areas to improve and do things more efficiently, more effectively. And that cannot actually happen without the significant investment, both from the design and procurement of the health centers and the staff as well. So a little bit about PHCC. So Qatar is actually a peninsula, as quite a few people would know. On the northern side, eastern side, and the western side, we've got some beautiful beaches. And on the southern side, we are actually bordering with Saudi Arabia. You'll see from the slides that the cluster of the health centers are actually in and around the vicinity of Doha, which is the capital of the state of Qatar. In terms of our services, we have a wide range of services, primarily the family medicine model, some specialty services in clinic, which I'm going to talk about, health promotion and disease prevention, lab, DI, home care, physiotherapy, dental services, as well as primary pharmacy services. In addition to that, we also have some specialty services at the health centers, such as dermatology, ophthalmology, ENT, cardiology, psychiatry services, peds, well baby, and physiotherapy. So some of these services are actually offered in collaboration with our secondary care partners, which is our Hamad Medical Corporation. In terms of the registered clients, we've got 1.7 million plus registered clients, 5,000 plus clinicians, and 50 plus services that we're offering across these 31 health centers. Now, if we actually talk a little bit about the virtual health journey and the timeline, first and foremost, PACC's virtual health strategy is actually supporting, it's one of the 6 strategic priority areas, which is the effective, innovative organization, which is to implement the telehealth and e-health strategy innovation. Now, this strategy was put in place in 2019. So from 2019 to 2023, we were actually executing the strategic plan. And in 2020, as we all know, that COVID had changed the landscape to the point where really in a matter of days and weeks, we had to actually deploy things. So in 2020, we actually had seen that how virtual health scope was actually defined. Some of the phase implementation was actually expedited. We scrambled together to actually put together some of the virtual health policies. We drafted those. We ended up actually, expediting some of the procurement of the virtual health equipment, its readiness, the training for the clinical staff from clinical and technical perspective, as well as ensuring that community is aware of all of the services that that were being offered. And around that same time, we really took a hard look at it ourselves and try to actually understand, where we are, what is our strategy saying, and from what we're actually learning from COVID as we're going through, what are some of the areas that we needed to actually focus on. So we started to actually conduct some gap analysis, really understand what are some of our high priority areas of focus for the next coming years. So in 2021, we actually had our third cycle of accreditation. It was in the middle of COVID, so we actually took a hybrid approach to the survey. And after a successful completion of that, the third cycle, where we came back again for the second time at a diamond level accreditation, and first in the world to have actually achieved the PCC Commitment Award. At that time, we decided that we need to actually look at inducting some of the new standards. That was around this time in 2021, where we've actually took on from the 3 new standards, virtual health standards, as well as emergency and disaster preparedness. We thought that, in light of what we've actually seen with COVID and where Qatar was actually heading in terms of actually hosting that grand event, FIFA World Cup 2022, we thought that these 2 standards could definitely help us, in really putting together some of the structure. So in 2021, as we were actually working on reviewing and updating some of these policies, enhancing in some of the pathways, we started to expand our scope of virtual health. Video consultation, cancer screening centers, community call centers were rolled out. We started to actually look at some of the data that was actually being coming from the enterprise data warehouses and try to actually form the data into a meaningful information. The dashboards were actually introduced. Utilization dashboards were slowly, being shared with the stakeholders. So we saw that happening. And then with the virtual health standards, that really helped us in putting together that structure. So in 2022, we saw the video consultation optimization happening. We continue to expand our services and whatnot. We wanted to actually make sure that our CIS optimization is actually happening, where we continue to actually look at increasing our bandwidth, medication home delivery, several different initiatives to make sure that we increase our virtual care utilization. And just in 2023, as we look to integrate some of the work that we're actually doing with Hamad Corporation, we continue to actually expand our services, optimizing our virtual health services to make sure that we make it more robust. The whole continuum of care is actually there, how we actually utilize some of our technology that we have at the hand of our patients and use that so that they can actually get the timely treatment that they're actually looking for. So now what I'll do is I'll talk a little bit about information governance. And the reason being is that in light of the theme that we actually have for this year, it's actually important that we actually touch on, because as the virtual health services is developed with the goal of providing quality of the care and the safe care for patients, it was important for BHCC to ensure that all of the relevant safety laws, privacy legislations, regulations, and international standards and the code of services are met. And this information governance management at PAHC, this was that combination of that legal requirement and the best practices that we were actually complying to from Ministry of Public Health and the Ministry of Transport and Communication, focusing on the confidentiality, integrity, availability of the services, and also the quality of the information for the intended use for the patients and for the clinical staff. So as we introduce a virtual health standard, it really helped us put together that structure again, where now the interoperability plan was actually needed. So the main intent of the interoperability plan for us was to make sure that we're actually providing the safe, secure, efficient, quality care within our healthcare system. So we actually focus on 3 priority areas. So the healthcare management system, the standard and data management, as well as the process maturity evaluation. So with those 3 priority areas, we had actually developed the virtual health quality management plan and ensure that all of the relevant quality measures were not only just monitored, we had the controls in place, as well as ensuring that we actually have a robust quality improvement plan that is aligned to our virtual health strategy. So with all of that work that was actually now happening in that virtual health quality management plan, which is supporting our interoperability plan, with these 3 focus areas, we wanted to make sure that we have the governance in place. And that's where we looked at what we currently have in place. We had the ITIDT committee, which was Information Technology, Innovation, and Digital Transformation Steering Committee. We had the Health Information Management Steering Committee, but we had to actually introduce what we call a virtual health services subcommittee. And the focus of that was to not only make sure that, from virtual health standards perspective, that we actually have things in place, but we wanted to actually make sure that anything that we needed to actually feed to the appropriate stakeholders in a timely manner, whether at our PACC leadership level or at a national level, that we'll be able to actually do that. So hence that whole that governance, the maturity that we actually needed, it was actually offered through that. So I just wanted to actually highlight that until 2021, service excellence was one of the standards that we were already using, and that was really helping us in terms of ensuring that we have the right metrics in place, engaging the patients and partners, and making sure that the right things are happening. But with the virtual health services and putting together service excellence standards, that's where we actually saw some true benefits of it. And with the information governance, it's actually important to actually note that PACC had actually gone through several different security certifications, ISO 20000, 2018, for the information system management 27001, and then also for HIMSS level 6 for those of you who are actually aware that HIMSS Analytics Stage 6, we're at the outpatient electronic medical record adoption, and we're actually aiming to actually go for HIM level 7. Now let's actually talk a little bit about the patient engagement and information technology. So at PACC currently we have two different platforms. So one is what we actually call our web portal, so patient portal we actually call it. So the virtual health services, these are actually designed using the patient-centered approach in mind. So that emphasizes patient engagement, making sure that our clinical staff and our patients are working together to look at what is important for the patient. So in our patient portal, there are some of the e-services that are actually shared, the upcoming appointments, the medication details, so the medication that the patient would be in, their last vital signs, the lab results, allergies, the procedure reports, because we actually have one system that actually speaks from primary care to a secondary and tertiary care between Hamad and PHCC. We have that that added advantage of making sure that patient doesn't have to repeat the story. The information is readily available and it's actually readily accessible as well. So we're actually seeing how documents from the discharge summary, medical reports are actually there. It's actually present, and currently we have about 173,000 active users that are actually using this service. And then in terms of the virtual health services, with teleconsultation, with the video consultations, those are actually ongoing. We have community call center, which is 24/7. We also actually have the medication home delivery. And also we have recently launched last year a mobile application, which we're extremely proud of. It's something that we have actually developed internally, but it's actually complying to all of the regulatory requirements from the Ministry of Public Health as well as the Ministry of Transport and Communication. The app is actually called the Nar'akum application. I'll talk a little bit about Nar'akum, but at the same time, it's actually important that when these type of virtual health services are actually offered, that we are doing our part in ensuring that the community is actually aware of it. So PACC actually done a fair bit of work in ensuring that we provide that sort of the media activities through different modes, press coverages, as having the spokespersons, social media, webpage, SMSs, and the videos that are actually shared across the country to make sure that folks are getting more comfortable around knowing exactly how to access these services. So there has been a significant amount of work that has actually happened in terms of providing that sort of media activities. So Nar'akum is the app which we're extremely proud of, and this is one of those success stories where we proudly actually share with others in terms of how we have looked at co-design the service with our patients and partners. So as you can actually see from the screen that it actually covers a fair bit of things where you can actually register a new patient, your family member, you can change your family physician, if you see the second tile in there, it talks about releasing the information, your lab results, your radiology reports, your ultrasound reports, and x-ray. This is actually in a beta version. It's actually in the works. You can add another you can actually have appointments that you can actually take on. You can actually change your your family physician. You can actually provide timely feedback. And as I mentioned, from that web portal that we actually have, the patient portal, all of those, any sort of, the certification that's actually needed, vaccination certifications, leave absence of leaves applications, all of that can be actually accessed through there as well.